Hi, good evening, everyone. I'm Dr. Philip McMillan, and you will be glad to know that the US death rate is at a record low based on the recent CDC data. I remember seeing this a few days ago, and I thought, how in the world is that possible? Because it just didn't make sense. Everything that I've been looking at over the past few years indicated that we were going to have a problem. And when I looked at my data, because I've been analyzing lots of data over the past few years, looking at NHS hospital admissions, you can see there are rising numbers with hypertension, heart failure, myocarditis, atrial fibrillation. This is just cardiometabolic, looking at endocrine, fluid and electrolyte disorders, inflammatory disorders, ulcerative colitis. All of these things are rising. So if this was happening in the UK, why in the world would it be different in terms of the United States? So you had to look a little bit deeper. So this is what I'm here to try and explain to you. Here is Reuters as well talking about the same thing. And you can see here, US provisional mortality rate falls 4.6% in 2025. At least they were a bit more honest here, where they said flu deaths rise. This is very important because sometimes when you're looking at overall mortality, you can miss the detail by just assuming that the standout number or headline is the relevant thing. So as we look here, you can see that the deaths fell from to 689.2 per 100,000 from 722.1 a year earlier. However, this is the bit that you mustn't miss. The number of deaths from influenza and pneumonia rose 17% in 2025. Now, this is absolutely critical when you're trying to understand what's going on. And this is here what I'm trying to tell you about how to understand what it is that they're talking about. So rather than just giving you general information, I went and got exactly what the CDC published. So this is their vital statistics rapid release for July of 2026, looking at mortality in the United States. It's provisional, so it's not yet fixed. And it's giving you an idea as to the things that people were dying from in 2025 and looking at 2024. You can see here there were 3,094,000 deaths in 2025. And they break it down here by the leading causes of death. Heart disease is still at the top, cancer followed closely, then unintentional injuries, stroke, respiratory infections, and it goes down the line. This is important because you've been told that there is like a huge protection that is happening with regards to COVID vaccines. So you can imagine how much higher this would be if so many people weren't being injected. I'll come to that in a little bit. I'm being a bit sarcastic here. But the point is that this is what the real data showed. Now, there's an important caveat in that. And this is the bit that I want you to be aware of. So I'm going to make this slide a little bit bigger here so that you can see this better. When they looked at the ages, and this is the provisional number of age-adjusted deaths, of total deaths, and they looked at 2024 compared to 2025, 3,072,000 in 2024, 3,094,000 in 2025. But because of the population change, it's still actually lower in 2025 than 2024. Additionally, when you look very carefully down here, what's interesting is that the total number of people dying in the over 65s in 2024, that's 68,416, 639,457. But what they're saying is that there is a fall in terms of the number of people who are getting older. And so, on balance, even though more people are dying over the age of 65, according to the population demographics, that percentage or that rate is actually lower in 2025. What's very interesting, though, is that when you look carefully at 2024 numbers for almost everything below the age of 65, it seems to be going down. I wonder what changed. So, let's dig into what this actually really means. And this is where it's important to therefore get the facts. Even though the numbers are apparently at a record low, what really caused this fall to occur in the United States? Because as I said, based on the data I'd been looking at, I couldn't see how this was possible in regions that are highly vaccinated with high circulation of ongoing COVID. It makes no sense. So here is what the reality is. When you look carefully at what happened, their overall mortality rate, as you can see, is coming down to what they call the lowest it has ever been, 689.2. However, what is driving it is this here. And so you have to look carefully here. You can see that there was from 2019 up to 2022, there was a very significant rise in overdose deaths. And these then rapidly fell down 14%, down to the lowest it has been since 2019 in terms of unintentional drug overdose. Now, this is something related to potentially what is happening with regards to fentanyl and so on, which is useful, but it is hiding within that the fact that people are still quite sick. So let's look more carefully at what actually is happening in terms of everything else. This is where the data is very relevant. Most chronic disease deaths, however, are up in 2025. Heart disease is rising, 1.6%. Cancer is up. Stroke is up. Lower respiratory tract infections are up. Alzheimer's is up. And look at this, influenza and pneumonia is up 17%. Something is wrong. So all of these things are rising, but simply because of a dramatic fall in overdose deaths, suddenly it appears that they are at the best case they were. This is what should I say? This is giving you a false sense of security. Something is wrong. And so what I'm saying to people is that don't get too excited when they start telling you everything is fine, because the numbers, when you drill them down, are telling you something very, very different. And this is why I'm saying that based on everything that I have seen and the total characteristics as to what's happening to people, people are still very sick. Total number of deaths actually increased by 0.7%. Most major chronic diseases are climbing. A lot of people are sick, chronic conditions, the population is aging, and critically, they have not even taken into consideration the mortality debt. What I mean by that is, if you've had a pandemic with raised excess mortality for a number of years, people can only die once. And so people who were sick and frail would die. It's not like in a war where your young and healthy people die. In COVID, it specifically impacted the older cohorts and people with comorbidities. So all those people died in 2020, 2021, all the way up to 2025. Now, after all of those deaths, your death rate is still not really below where it was before 2019. This is what the reality is showing. And what it's indicating is that we have quite a serious problem on our hands. Don't get distracted by the fact that overdoses are less. That is good. but it is not really giving you the reality as to what is going on. Here is where I want you to concentrate because this is where it really matters. Look very carefully at this number: 17.4%. Influenza and pneumonia. It moved from 11th to 8th as the leading cause of death. You will notice there is no COVID anywhere in this. And that's because apparently COVID has disappeared. Listen, what we're facing now is quite an unusual situation where COVID is circulating avidly, especially in highly vaccinated regions. I know this annoys people when I say that, but it is just what we're being observed. And critically, what is happening is that we are no longer seeing severe COVID. The data from Denmark indicated that for people who are over 65 who got a COVID infection, I didn't mean severe COVID, they just were COVID positive up to 2 weeks before hospitalization, there is a 12% mortality within 30 days. This is what I think is causing all of these numbers, not just pneumonia, but heart disease, stroke, Alzheimer's. All of these things are being impacted by ongoing circulation of COVID. But here's what: nobody wants to talk about it. Certainly not the government or public health, because it would give the impression that their strategy has not been as effective as they had hoped. And the public are happy to go along with this because they can't be bothered to listen anymore with regards to what is happening with regards to COVID. The public is just tired of it. The reality, though, is that this is not going away. We've got a problem. I just keep saying the same things over and over again, and I'm not worried because I know that the science is not going to disappear. That's why I keep talking. A lot of people think, well, why are you still talking about COVID? I'd say, okay, I'll see you in another 2 years. You'll see why I've been telling you for the past 4 to 5 years, this is not going away. Here is one interesting thing, though, that I've found, and I've been reflecting on it, and I'm not going to say that it's relevant in terms of the mortality, but here is what is happening in terms of COVID vaccine intent in the United States. Again, this is from the CDC. When you look at adults here, you can see that dark, almost black hair represents the people who have gotten the vaccine, definitely will get a vaccine, probably will get a vaccine, probably or definitely will not get a vaccine. And you can see when we reach here, almost 50% of the population have no intention of adults of getting one. About 27.2 are unsure. 7.6 have gotten it, are still thinking about it, and 17.5% have already gotten it. This is at the lowest in terms of the amount being given out at the moment. And it would make you wonder whether or not this could be an impact in terms of the ongoing issues in terms of the population. What interestingly seems to happen is that, and this is an important point, I am not anti-vaccine. I'm not even anti-COVID vaccine. I just knew that we needed to be cautious with it. But there seems to be something that is happening that really needs to be understood. For people who are getting their booster doses, they seem to be at lower risk from those who didn't. Now, what I don't think they're clearly expressing, and this is my analysis and interpretation, and this is something that I think the public really needs to reflect on carefully. I'm not talking to the unvaccinated, meaning if somebody is unvaccinated at this point and they've been fine, they can still get COVID, but mucosal immunity is pretty good unless they have got some kind of immune suppression. But when I had looked previously at the data looking at vaccination status. I remember in 2022 seeing the data that for people who stopped getting further doses, their mortality was higher than those who were boosted. And almost everything we see in terms of the data coming through seems to be pointing to this. I am beginning to worry that maybe, and it could be IgG4, which is an immune suppressive antibody, has some degree of protection against inflammatory processes that can occur after COVID infections. And so, what it does mean is that potentially people who are already vaccinated, who are already boosted up, they can't come off the treadmill. And what we need to understand is that if that is the case, there needs to be honesty in terms of public health. And they need to say, listen, we're really sorry, but once you are in this boat, you can't get out. We don't know yet how to fix this. And in order to keep you well, you need to continue getting those boosters. That's the kind of conversation that needs to be had. Now, I am very objective on this, but I can see from all the data and looking at the patterns of illness that there is no easy way out of this mess. Some people say just stop giving everybody vaccines. I'm thinking to myself objectively, if you drop the IgG4 levels, then it means when they get an infection, they're going to be producing antibodies or immune responses that can do more damage. I don't know how we fix that. But the point is that we have to first reflect very carefully on what the science is saying, be very open and honest with the public about what has happened, and reflect carefully on what that means in the longer term. Because we have no idea the longer term outcomes of 15, 20, 30 booster injections of mRNA with IgG4. There are just so many unknowns in this picture that the most important thing, I think, is honesty. And to say, well, here is what we know, here is what we don't know, here is who is affected, here is what we understand so far, but we are working to try and get answers. At the moment, the public is just being left to their own devices, and nobody's giving guidance or explanation. They just hope that everybody keeps on going. But just remember this, no matter which way we take it, I cannot see how, from a scientific point of view, with all the inflammatory processes tied to the spike protein, whether it's from infection or otherwise, I cannot see how disease and mortality is going to drop in the near future. Final thought, just look at the data. Everything is rising. We need to understand who is being affected most and why, and understand the science behind it. That's the call to action. So now is a time, I think, that we really need to work together to find solutions. Thank you very much for listening. Have a great evening.